96.3 FM, The Source.
All right, 20 minutes after 11 o'clock. Hope you're doing well. When you are going to be a parent soon, so therefore you're pregnant, right?
Yes.
I think you ladies have a completely different experience here than us guys. It was the greatest thing that ever happened to me, having a son.
Oh, it was the greatest thing that happened to me, too.
Yeah. Did you go as a woman, of course? Did you have the postpartum depression experience?
Nope,
No?
I did not. I enjoyed my children immensely, so I did not fall into that trap.
So I wonder what that is. Dr. Samantha Meltzer-Brody is on the phone. She's the Associate Professor and Director of the University of North Carolina Perinatal Psychiatry Program of the UNC Center for Women's Mood Disorders. She's going to talk to us about diagnosing and treating postpartum depression. Good morning, Dr. Meltzer-Brody. Good morning, Doctor.
Good morning. Thanks for having me.
Wow. So yeah, I'm thinking this is exclusively a women's issue, right?
No, it actually is a women's and families issue, and it's something that is really, really common, affecting 1 in 7 women, and in fact, it's one of the most common complications of childbirth.
And is there an easy-to-understand reason why somebody would be... And if I use the word sad, is that different than depression?
Well, I think that sometimes depression can include sadness. So for women that have postpartum depression, it's not just feeling a little sad. It's actually having depression, which can be sadness. It can be feeling very low mood. It can sometimes present with a lot of anxiety, feeling very, very overwhelmed. And so certainly having a new baby is a very exciting time. It's often an exhausting time. But for women that suffer with postpartum depression, there's so much stigma about having to reach out and say, I'm not blissfully happy about this. I'm actually feeling completely overwhelmed or very down and blue. This isn't what I thought it was going to be like. That's hard for people to say, so that's why we really appreciate the opportunity to increase awareness.
Is it because that maybe the women aren't being paid attention to as they were during their pregnancy, because people would come up to them and say, oh, this is wonderful, you're having a baby, and they were the center of attention, and then when the baby comes, the woman is jealous because she's not the center of attention anymore?
Well, actually, I think that a lot of the research shows that it's not a woman's fault at all. That, in fact, that some women are biologically vulnerable to all the normal hormonal changes that happen from the transition from pregnancy to postpartum. So during pregnancy, there's very, very high levels of female hormones, estrogen and progesterone, and those really drop dramatically postpartum. For reasons we don't entirely understand, that hormonal ride, if you will, can trigger postpartum depression in women who may be vulnerable. Some women have had a previous history of depression or anxiety, or even a previous history of postpartum depression. Other women have no mental health history, and we know childbirth can be a trigger for this. So it's really important to emphasize, in the same way that it's not a woman's fault if she gets breast cancer, it's not a woman's fault if she gets postpartum depression. And it's something that, again, around the globe can be 1 in 7 women. That's a lot of women. And that's about 400,000 families, a little under 500,000 in the U.S. every year.
So I don't know if this is a fair question, but is it an across-the-board remedy, or is each woman different, and should a doctor be kind of looking at everybody individually? Can you give a radio answer, I guess, is my real question.
Yes. So I think that each woman needs to be looked at individually. Each woman's history is going to be different, but there are some common things that women can do. So talking to your doctor, getting treatment, making sure you're screened. Most professional organizations, American College of OBGYN, American Academy of Pediatrics, are all now recommending screening for all women during pregnancy and postpartum. And there's a variety of standard treatments right now. There's different forms of talk therapy, psychotherapy. There are antidepressants that are used during this time, and there's, an opportunity for new treatments to be developed that may be very specific to PPD. But this is something that is common, can cause enormous suffering. In fact, maternal death from suicide is one of the greatest causes of maternal mortality. So this isn't something that can be overlooked. And because so many people suffer in shame, I think that the stigma around any mental health, and if your neighbor says, was never more blissfully happy, it's really hard then to say, well, actually, I'm really suffering with this. So we need to support all moms and recognize this as something that is common.
So I see now why you say it's really a family issue. Is there anything that the family, the husband, the partner can do or not do that is a good suggestion?
So yes, I think that helping to decrease the guilt and shame. So it's helpful for people to realize, wow, this is common, and there's some great online resources for families. So postpartum.net is run by Postpartum Support International. 2020 Mom, CPPD, that's SEEPPD.com. These have great information, so dads, partners, families can go online, read about it. Oftentimes, the mom or the dad will say, wow, that's really what we have going on here. That helps people understand that I'm not alone. I often find in dealing with patients that they would be very happy to talk about their diabetes of pregnancy or a complicated emergency C-section, but people will hide that they're depressed.
Oh, that's interesting. Wow.
And so this probably affects the relationship between the mother and the baby when the mother says that she has this postpartum depression. So the baby should be taken care of by the dad then until the mom is deemed getting well.
Well, it can affect it, and sometimes moms may have a more difficult time bonding with the baby, and that's why getting early treatment is so important. Oftentimes people are really overwhelmed and they absolutely need the help of dad or grandma or another family member. The good part, though, is there can be treatments that make a big difference. So that's why families supporting moms saying, let's get through this together. I think seeing it as any other medical complication and getting around the stigma piece is really important. So saying, look, you have something that affects 1 in 7 women. Let's make sure we're getting the help we need. Let's rally together to get through this so that we have best outcomes for you, for a baby, and for the family. It's really hard on a family when mom's depressed. That's hard on a relationship. And so the sooner you can get treatment, the better everyone is.
And does the treatment sometimes include a pharmaceutical of some sort?
It can. So psychotherapy is common. There are standard antidepressants right now that, while not specific for PPD, are commonly used, the selective serotonin reuptake inhibitors. And there, while there is a need for specific pharmacologics for PPD, there are things that can be used now. So screening and getting treatment now is really important.
Dr. Samantha Meltzer-Brody, thank you for taking time to talk to us about this. And for the listeners, the website that the doctor gave us was S as in Sam, EEPPD as in postpartum depression, SEEPPD. We'll put that on the podcast when we upload it later on. Doctor, thank you for being on the air with us today, and thank you for the work you do.
Well, thanks for the opportunity. I appreciate it.
You're welcome. We will be right back.
Fox News Radio, I'm Chris Foster. New York's Attorney General Eric Schneiderman's now under criminal investigation. He's resigned, accused by 4 women of abuse, including choking and slapping.
3 of his accusers he'd been romantically involved with, a 4th claiming she rebuffed